everybody, my name is Rachel. Welcome to my YouTube channel. I am currently 33 weeks pregnant and thought today is a day I need to share with you guys some tips and tricks that I have learned from my last pregnancy and this pregnancy on how to reduce back, pelvic, and hip pain. The first way to prevent back and pelvic pain is to correct our posture first. The way to do this is that you have to engage your abdominal and pelvic floor muscles by tightening them before and during all movements. To go from a sitting to standing position, you don't want to overuse your arms. First, you start off by moving your ankles. This helps promote blood flow, which helps prevent dizziness. Then you want to scoot forward, placing your hands on your thighs, leaning forward, and using your legs to stand up. While standing, you want to make sure that your weight is equally distributed on both feet, tightening your abdominal and pelvic floor muscles, and relaxing your shoulders by slightly bringing them down and back. And this will help prevent back and pelvic pain, also in the hips as well too. With standing and walking, it could be a little bit difficult with the weight gain and our tummy growth. This automatically, naturally, just gravity pulls us forward, which messes up our posture. So in order to correct that, you want to move your weight from your toes to your ankles. This way, our shoulders, hips, and ankles are aligned. When you correct your posture, you will automatically feel your abdominal and core muscles engage. This way, when you walk, you will walk correctly without a waddle. While sitting, you want to make sure that you have a good posture as well. You want to make sure that your feet are evenly placed on the ground firmly to help reduce swelling. Also, you want to sit back in your chair for support, and for additional support, you can have a cushion or pillow. Also, make sure that everything is at elbow height and within your reach too. Also, you want to make sure that periodically you are moving your feet and ankles too, because this helps reduce with swelling as well. With getting dressed, it can definitely help by sitting in a chair, so this way you're not having to balance your weight from one leg to the next. This can help with when you put on your shoes, your pants, or even your panties. To lift objects properly, you want to lower yourself down to one knee. Engage your abdominal and pelvic floor muscles, picking up the object and holding it as close to your body as possible. For additional support, place your hand on your thigh and push down. Now, if the object is heavy, you'll want to do this in stages. So first pick up the object and you can place it either on a stool or a chair, then stand, and then you can pick up the object. To get into bed or into a laying position, you'll first want to sit down and then lower your head and shoulders down onto the pillow while moving your legs up all in one motion. Let me show you how. To get out of bed, you'll want to drop your legs over the side, pushing up with your arms. You'll then want to scoot to the edge of the bed or wherever you're laying and placing your hands on your thighs for additional support so you can push off using your legs for support to get up. To turn over in bed, you'll want to bend your knees up, also tightening your stomach muscles a little bit, and also tightening your booty muscles, using these muscles to lift up your booty and turn over in bed. This way, you're using your core muscles and avoiding using your arms as much as possible. So go ahead and squeeze your stomach and your booty muscles again, lifting up that booty and turning over. Thank you guys so much for taking the time to watch this video. If you guys are new to my channel, this is my beautiful 2-year-old little Miss Mila Janae. And if you guys have any other tips and tricks that you want to share, please leave a comment down below. And also make sure to give this video a thumbs up, subscribe down below, and also share with a friend. All right, you guys, have a wonderful day and God bless. Mwah. Bye, you guys.